questions over the past few days, and we have a number of questions in a number of areas around face covering requirements, outdoor dining, and then some non-COVID related questions relating to the city budget, which I'm happy. In the number of COVID-19 infections. And while we need to continue to safely reopen our economy, we need to balance that with also looking at the data and making sure we are doing it thoughtfully and safely. And Dr. Hernandez will update us on the latest number of cases and testing in Berkeley. We have significantly increased our testing capacity in Berkeley from where we were 2 weeks ago. Our test site in South Berkeley is testing people throughout the week. I actually got tested myself, and it's very easy for you to sign up to get tested. Go to the City of Berkeley's website, cityofberkeley.info/COVID-19. We encourage all essential workers and local residents to please get tested, and certainly if you are symptomatic. So we'll touch on testing, we'll touch on the shelter-in-place order and city operations, as well as a lot of issues that you've written to us about. So I just want to take this opportunity to thank the Berkeley community. Our shelter-in-place order started on March 17th of this year, and it seems like it was really a decade ago. So much has changed over the past several months. And we know that, even as we are slowly reopening our economy, that COVID's going to be with us for even longer until a vaccine is widely available. And so it is important as you go about the city, as you go to work, as you visit your local restaurants, that you do follow the directives to wear a face covering, to practice physical distancing, because this is very important to help Berkeley control the spread of COVID-19. So with that, I want to turn it over to our City of Berkeley Health Officer, Dr. Hernandez. Dr. Hernandez, thank you for joining us, and thank you for all your work. And if you can update us on the number of cases as of today, on testing, and any other issues that you'd like to address to the Berkeley community.
Good afternoon, Mr. Mayor and City of Berkeley. As Mr. Mayor said, the mayor said, key to controlling this disease right now are the basic things that we've been asking you to do, which include staying home when you're sick, washing your hands, and wearing a face covering. This is to protect others, so that we know that COVID-19 is asymptomatic and sometimes can be spread to others when we don't know that we're sick. So we definitely need people to wear their face coverings. That said, let me get into the numbers and talk to you a bit about what we're seeing, both in the City of Berkeley, Alameda County, and throughout the state, and how those numbers and some of the other indicators help to make decisions in terms of how we're doing with relaxations, how we'll go for the next few weeks, and then I'll get to some of the other activities we're doing. So in terms of cases, for Alameda County, we're now at 5,354 confirmed cases with 129 deaths. In City of Berkeley, we're 139 confirmed cases with 1 death. Of the hospitalizations that we're seeing in Alameda County, we're seeing that they are rising some, but not at the rate that we were seeing earlier, actually about a month ago, back in the end of May. Now we're seeing those increases at about 3 to 5% for the last week or so, which is definitely concerning, but it is not as increasing as it has been in the past, and we're watching that. In terms of City of Berkeley residents, in terms of hospitalizations for them, we've been pretty stable. Again, any hospitalization is concerning to us. And what we've seen, though, is that we have not seen an increase in hospitalizations for the City of Berkeley residents. But we look at the data for both Berkeley and City and Alameda County. In terms of testing, as the mayor mentioned, we've definitely increased our capacity for testing at the new test site, which is open to anyone who wants to be tested, symptomatic or asymptomatic. And you don't have to live in Berkeley. You could live and work in Berkeley. You could live in Oakland and come to the site, but we're seeing about 80% of the people who are getting tested at that test site being either someone who works in Berkeley or someone who lives in Berkeley. So that's excellent. And that has increased our numbers for the indicator that one of the indicators that we're tracking, which is the number of cases per day on City of Berkeley residents. We're now on average at 219 tests per day. And that is about 90% up to our goal, which is amazing. Our goal is 245 tests per day, and that's not just for the sites that that we sponsor or are collaborating with, but any person who is City of Berkeley resident that's tested in the community by Kaiser, by Lifelong, by Sutter, by a private doctor. Those are the things that we're looking at, and we get those data from the providers and the labs. They're required to report any test that is performed on a City of Berkeley resident to us. So that is positive, negative, inconclusive. So that's where we get those numbers. And what we're also looking at, besides the number of tests that are done, is the percent positivity. So we look at how many people, or what percentage of people that are tested actually are tested positive for COVID. And that helps us look at what the incidence of disease is in the community. We're currently at 1.8% positive. And what we want is something below. We want something at 0. But what we want is definitely below 2%. And we are at that number. Alameda County is at 3.7%. So definitely a little higher than us, but overall, we're still doing well. When we're looking at our data for the city and the county, we also are looking at that in respect to the Bay Area, and we're looking at it in respect to California. And yes, what you've seen in the news is that there's been some concerning cases, especially increased hospitalizations in Contra Costa and some of the other counties surrounding us. And that's worrisome. We also have seen down in Southern California, especially Imperial County. I think I reported on that last time, where there had increased hospitalizations there. It's getting worse in that county. They're actually seeing 23% positive for tests that are performed down in Imperial County. We're at just below 2%, and they're at 23%. So there's a significant difference, and we're watching that. And what the governor has done is urged that Imperial County has reinstitute their shelter-in-place orders. So we are watching that. We know that some of the Bay Area counties are slowing down, or not opening any more activities or sectors because of the increased cases. Alameda and Berkeley are not going to reopen. We were watching it and considering opening every 2 weeks if possible. That is not going to happen. Right now, we are staying as we are. We are working with some of the businesses so they are compliant with our orders. But right now, we are not moving forward with adding any additional sectors or activities to our shelter in place. That said, Alameda County is attesting, and submitting an attestation is basically a plan that gets submitted to the state, showing where we are in our indicators, where we are with our response efforts. It's essentially a response plan, a preparedness plan. So it shows the governor and the state where we are, and actually the community where we are. And that's going to be submitted in the next few weeks. We are collaborating with Alameda County to submit the data so that everything is available to the governor, and actually it's available to the community, because those attestation plans are posted on the web. So that's something I wanted to let you know, that we are moving forward. One of the reasons is because it allows people to see what we're doing, where we stand, and it also will help you see what we're doing as a county, as a city, in relation to the state. and also allows us to open certain sectors and activities that we're not allowed to open unless we've attested. So I know there's questions about when will the pool get open. So some of those things that we're not opening are not being allowed because we're not attested. So that's when we're able to move forward, when we feel like the data is supportive enough, then we'll be able to add some of those activities in. The only other, I want to talk a little bit about the indicators. We have the 5 indicators I've talked to you about before, which tell you how I'm looking at the data. One of which I've spoken to you about already, which is cases and hospitalizations, and they have to be flat or decreasing. Of course, we have not met that, as I just reported. Sufficient hospital capacity, we continue to meet that, which is definitely something that we are monitoring daily. In terms of testing capacity, we have not met that, but we're improving. We're at 90%, so that is excellent news. Sufficient case investigation, our disease containment efforts, we have reached that goal, and we continue to reach that goal. That includes how we are identifying cases and isolating them. And their contacts and quarantining them. We're above 90% on all those measures. And the last is sufficient personal protective equipment for our healthcare facilities and our hospitals. We have not met that one. Again, our supply chain is opening up, and we're hoping that the facilities will get more of those equipments. One of the issues that equipments they were worried about that was in low demand were gowns. We're getting more of those, so I'm hopeful that we will see that change. In terms of testing, the mayor mentioned that we have our test site on Oregon. That is open 12 hours a day, Monday through Friday. And you can sign up on the web for that. And again, it's for anyone who wants to get tested. There are appointments. Sometimes there are same day appointments. Even if you've checked one day and it looks like it's full, check again, and maybe you can get in same day. They sometimes are able to take walk-ins. So there's a phone number on the web as well, so you can call. And that number is 1-888-634-1123. I'll repeat it again, 1-888-634-1123. So that's one thing I wanted to share with you in terms of our testing. In terms of our other site on 6th and University, that continues to operate. We're also doing a mobile portion of that test site. So we've gone to senior apartment complexes. We've tested individuals on site who have disabilities, and we're working with the skilled nursing facility staff, because they're required by state licensing and certification to test their staff monthly. So we're helping with that and providing that service of testing on site. So that's one of the things we're doing with testing. We're also working with the Office of Economic Development in partnership with the testing coordinators, have started testing and offering special days for grocery store staff and employees and other business sectors. So we're trying to have the opportunities for testing be available and also mobile, so we can get to those communities that are not able to get to our test sites. And we're trying to expand that every week. In terms of our disease containment, I told you we're doing well in terms of meeting those indicators. We've onboarded new case investigators, and we have a supply, I hate to say that, a number of contact tracers that are on board. We have about 17 that we've started to tap into. We're also getting some staff from the state as well, and that'll happen in mid-July. We're using a new state platform for contact tracing. So we're onboarding that. We're onboarding a platform. We're onboarding staff. So we're chugging along. We are seeing more cases, and I want to talk a little bit about those. They seem to continue to be in essential workers who are working, who don't have the luxury to stay at home, and they're spreading it in their households. We are not seeing outbreaks as some of the other jurisdictions are. We're seeing them mostly in households. We are seeing some in congregate settings, mostly student housing. Some of those, some of the Cal students are still here. They love Berkeley, and they are here for the summer working, and some of them are also still in their apartments, and we've had some contact investigations there. So that's where we're seeing the numbers, mostly household spread, and then some with congregate settings. Our long-term care facilities, there were 2 outbreaks that are now closed. There were no additional cases, so a total of 3 cases associated with those outbreaks. And they completed their weeks of testing, and now they're on basic surveillance testing, and they don't have to do response testing, which would be if we find a case. So the staff are getting tested weekly or every month. And then any new resident that comes into the facility has to be tested before, upon admission. So we are definitely working with those facilities. And last but not least, I just want to mention schools. We've been working with Berkeley Unified School District over the months, and we're hoping to have a specific, we've Alameda County Office of Education and Berkeley, Alameda County Public Health released guidance yesterday. We have been working with them as well, and we're not going to deviate from that plan. We're consistent. We will release some specific guidance with BUSD, hopefully in the next week or 2, but pretty much the guide that the county has released is going to be the same guidance that we would provide Berkeley schools. And on that, I'll end my report because I know there are lots of questions.
Thank you so much, Dr. Hernandez. And just to think about where we were 2 weeks ago, where we were just launching our new testing site at the MLK Youth Center on Oregon Street, and the number of cases that we've seen, and just how much that additional testing capacity has given us the data to make informed decisions. And in looking at the dashboard, I think we're under 2% in terms of positive rate of infections, which for a community of our size is actually pretty good. And I think that's due to all the work of our city administration as well as the Berkeley community to heed the guidance that the city has provided in its orders. But we need to continue to be vigilant in following those directives to make sure that we can continue to control the spread of COVID-19. But I just want to reflect where we were 2 weeks ago and how that additional testing site has really increased our capacity in order to meet that indicator that we need to be able to, I think it was like 245 tests a day. So I just want to thank all of our city staff for working to get that, and working with the state to get that test site up and running, because I think it's very important for us to better understand the level of transmission in our community and to be able to identify and to provide care for people that need it, who've contracted COVID-19. So with that, I'm going to now go to our city manager, Dee Williams Ridley. And Madam City Manager, thank you for joining us. If you could talk a little bit about city operations over the past couple of weeks and our response to COVID-19. The Emergency Operations Center is still in operation, and it actually was launched at the end of January and ramped up over the past several months. And so our staff have not only come back to work, and city operations are sort of transitioning, but we're also simultaneously working to respond to this public health emergency.
Absolutely. Thank you so much, Mr. Mayor. Once again, thank you for hosting the town hall this morning, and now we're on every other Saturday. So we're always having a tremendous amount to update now that we're going every other Saturday. So, but this is great, and we're really excited to be here. So thank you for the opportunity. So of course, the 3 things, I want to focus number 1 on just basic services that the city's continuing to operate. And then number 2, share a little bit about how we're serving the unhoused. And then lastly, just an update on what's changed since the last time we've had this conversation, and that'll be around parking. So of course, our basic operations, we are We're continuing with our citywide basic operations, things like repairing sidewalks, parks, taking care of our parks and shelter programs. And so those kinds of things are still kind of underway. We are still doing those baseline tree trimming types of services. But in terms of facilities, our city facilities still remain closed. It's only by appointment only for those critical services that people need to access. We have about probably less than 50% of our employees that are working from home or in some type of flexible category where they are still serving our community, still working. The majority of them are deployed as disaster service workers still in some capacity to support the EOC. And they've been doing a tremendous job there. And of course, our public safety employees have been on 24/7, fire, police, mental health, public health. Those services have always been in place and they did not stop even once COVID started. So those employees are still deployed. Our EOC is still fully operational, which means we've taken staff from other departments and placed them into EOC functions. And so that's why some of our services are still remain closed, but we are working. So all of our employees were returned back to work, I believe on June 1st of this month. And so they are chugging along, making sure that we're responding to our community. In terms of serving the unhoused, as you know, we have partnership with Dignity on Wheels, where we're providing free shower services and laundry services. And those are, I think at the Sea Breeze at 598 University Avenue, and that's from Wednesdays from 8 a.m. to 12 p.m. And also at 2nd and Cedar, next to 601 Cedar, and that's from Sundays. That's on Sundays from 3 to 7 p.m. It's been a goal of the city to house every person experiencing homelessness, but we have not achieved that goal yet. But we are following the Center for Disease Control recommendations for how communities can help protect unhoused individuals from COVID exposure. And some of the concrete steps we have taken include things like shelter decompression and alternative housing solutions, respite for positive or exposed individuals, hygiene resources, hand washing stations, and shower and laundry facilities, as I mentioned, and provisions of food and water to fill the gaps from usual sources. Once we went into shelter in place, our community went into shelter in place. And so those folks that were out there at the kindness of their hearts were providing these resources, food and water to our unhoused community. And so those usual sources are no longer there. So we have seen food and water insecurities, and we've been addressing that as well. We've reduced enforcement to allow less group intermingling. So our homeless community has also had to shelter in place. But as of recent, we've reconvened our team to start looking at how we can best serve our unhoused community while not requiring that they be disturbed and moved around and shuffled around the city. So we're looking at increasing our cleaning opportunities throughout the city of Berkeley to make sure that we keep a clean community and keep things healthy. And so we're also asking our unhoused community and our activists to support us in this effort to keep our community clean. And we are increasing our garbage service and pickup for that as well. In terms of parking, I do want to share a little bit about where we are with parking, because we are planning to change parking throughout the city. As most of you are aware, I believe it was in March, we suspended parking enforcement for non-safety related violations. That included parking meters. So as the shelter in place restrictions eased, we are resuming enforcement at parking meters to ensure turnover and to create available parking for customers visiting our reopening and the businesses. Enforcement begins for meters citywide on Wednesday, July 1st. And I want to make sure our community is aware of that we will begin enforcement again starting Wednesday, July 1st. Meters are still priced at 50 cents an hour in most neighborhoods. And last week we increased the rates to $1 per hour in 3 of our high demand areas. That's North Shattuck, downtown Berkeley, and Southside Telegraph. We will continue to monitor demand citywide and adjust hours and prices as necessary. Some time ago, I agreed to waive tickets, specifically those tickets that were associated with street sweeping. Street sweeping waivers will discontinue at the end of this month. So again, effective Wednesday, July 1, we will no longer be waiving tickets for street sweeping. And I want to make sure that our community adheres to our street sweeping requirements. We waived over 600 street sweeping tickets for our most vulnerable community members and folks that were trying to get their lives together so that they could adjust to our shelter in place. We also sent out a message to community members on Wednesday announcing all of these changes. So I would just want to re-emphasize July 1st, enforcement will begin again for meters citywide, and also waivers will discontinue on street sweeping. So those are my opening comments, Mr. Mayor. I do want to just thank the council and you, of course, for all of the work that you all have done around policy development to help support all of these responsibilities on our health officer and of course me as a city manager, but it's been very supportive having you all to put things in place so that we can effectively address the needs of the Berkeley community. And with that, I'll turn it back over to you. Thank you.
Thank you so much, Madam City Manager. So let's now turn to questions. We received a number of questions, and I want to first direct this set of questions to our City Manager as they relate to operations and enforcement. So the first question is around delivery fees that are being charged to restaurants. This is an issue that you and I have spoken about because certain businesses have reached out to us expressing concern about these service fees that food delivery apps and businesses charge. And so the question is, what is the city doing to help restaurants with these food delivery commissions? Washington, D.C., Jersey City, San Francisco, New York have all capped fees and commissions to 15%. Want to just ask you, is there consideration of providing some relief to restaurants with these specific fees? I know I've had conversations with officials in other jurisdictions in the East Bay about whether we can take kind of a unified approach to this through legislation.
So so at this time we have not made any deliberate improvements to our fee structures. But I do believe that over time, we do need to step back and take a look at how we can support our businesses even further. As you know, we've done a lot to support our business community, maybe in different avenues, especially through the Berkeley Relief Fund. But in terms of fees around charges for the transportation vehicles that help deliver food, we have not addressed that operationally here in the city as of yet. We are seeing a tremendous impact to, of course, our revenues here in the city as well. So it is a dual effect for both the businesses and for the city. So we're going to have to take a look at how we can assist them, but at this time we have not made any specific deliberate efforts to address that particular issue, but we have supported our businesses in numerous ways.
Okay, thank you very much. The next question is around whether the Commission on Disability can reconvene. I know that there are a limited set of commissions that are meeting at this time, so as to ensure that our staff are able to focus on the EOC response to COVID-19.
Right.
But I know that you and the health officer are sort of evaluating which commissions will meet and when they'll be able to meet.
Yes, so we're still, each commission, if there's a commission that has a specific critical and essential need to address, we are allowing those commissions to meet. These would be virtual meetings, of course. We have a number of them that are meeting, Police Review Commission, our Design Review, ZAB, I think FCPC. We have a number of them meeting at this time, and including our panel of experts for homeless services. So we're looking at those critical functions that need to be addressed. And if the Disability Commission has a absolutely critical and essential and/or time-sensitive issue that they need to address, we will definitely entertain that and allow them to meet. But we aren't reinstituting continuous, regular, reoccurring meetings. We aren't in that space yet, but we are certainly allowing for those that have essential needs. Again, as you stated, Mr. Mayor, most of this is about the availability of support services to allow those commissions to meet, to report, to develop agenda reports, to host the meetings. And we're just staff, we're staff shortage right now with our EOC deployment. So we'll continue to assess them on a case-by-case basis.
Okay, thank you so much. There was a very specific question around, it's not COVID related, but I think this will give us an opportunity to update the community about what the police department is doing. There was a question around the very tragic shooting death of a UC Berkeley student on Dwight Way in West Berkeley. And this specific resident asked, what is the Berkeley Police Department doing to try to identify the person responsible? I know that we've actually offered a $50,000 reward to anyone who has information who can assist in identifying the suspect. I know the police department is continuing to investigate this very tragic event.
Correct. It is a continued investigation. The suspects have not been apprehended at this time, but we are working on a number of issues around shootings in Berkeley. So specifically on 6/24, the shooting at Oregon and California, that involved multiple shooters, and one person was detained. I asked for an update from our chief this morning. One person was detained in that shooting. A gun was recovered with a high capacity magazine. No shooting victim was located though, but we did apprehend multiple shooters from the California and Oregon incident. We'll continue. Again, this information is, evolving, and informations on investigations are generally confidential until such time that we can release the information. But the investigation for the UC Berkeley student that died in the senseless shooting has not been detained at this time.
Thank you so very much. Moving on. A lot of questions around enforcement of the requirement to wear face covering outside. And I'll try to kind of consolidate these questions. People are noticing that restaurant workers, gas station attendants, postal workers, people that are out, walking on trails, people that are, out in the community trying to get exercise are not wearing face coverings. And the general question is, what is the city doing to try to educate as well as to enforce these particular requirements?
So we are continuing to educate our community, making sure that we update information, signage. We're even increasing our signage at parks and general areas in the city. We have 3 staff members that are deployed throughout the city during the weekend, specifically in our park areas where we've had the most impacts of people not wearing facial coverings. So we look at the data. Number one, we've been looking at where are we getting the most complaints, and they are around parks and open space areas. So we have deployed individuals to those locations. They are able and equipped to provide masks to community members that do not have a mask, and they're also asking them to observe the mask wearing requirement. At this time, we are not imposing any types of punitive and or criminal type of charges for people that are not wearing masks. And that is something that I would say has been shared across the region with law enforcement personnel. We are asking our city residents and pleading with them to comply with these orders to keep each other and themselves safe. And so we'll continue to look at deploying more city staff throughout the city over time as the data shows where we're seeing the most impacts in terms of people not adhering to the facial coverings rules. The last thing I'll say is, while people may see folks out there not wearing their facial coverings, there are more people that are wearing their facial coverings. And I do want to thank our community for doing that. You know, but you get nervous when you're out there and people aren't wearing the facial coverings and you have to walk by them. So we understand it. And we'll continue to think about how we can do that better in terms of keeping our community safe.
Thank you so very much. And you know, right now we're focused on the budget. We have to adopt a budget on Tuesday before the end of the fiscal year. So as soon as we get through our budget process, my intention is to work on a community education campaign around the importance of people wearing their face coverings and continuing to practice physical distancing. And you know, even if we continue to ease on some of the restrictions, it is going to be really essential that we continue to do this. So I think we're calling on the Berkeley community to be a good neighbor, be a good citizen, wear your face covering when you are outside conducting essential business. I do agree with you. I do see a lot of residents who are complying with the face covering requirements. I get a lot of questions, as I'm sure Dr. Hernandez and you do, around the requirements, and really just have your face covering with you when you leave the house. That is an essential thing to do. And when you are coming in close contact with somebody who is not in your household or your social bubble, wear your face covering. We really ask for your cooperation in doing that. So I hope that we can, you know, over the next month or two, you know, have a broad sort of community education campaign around this. But for now, we're asking for people's cooperation and participation. There was a really interesting idea I want to share that a resident had provided, which is, could the city implement a program where if police officer or other city staff person sees somebody not wearing a mask, that they provide them a mask? And I know that we do have kind of ambassadors that are out there that are going to be providing, they're going to have face coverings with them. So we are looking at that, non-sworn personnel. And then this resident had also suggested that people that aren't wearing their face covering, despite the warning, be given a fix-it ticket. We are trying to pursue non-criminal methods of ensuring compliance, as the city manager had mentioned. I do know that one San Mateo County supervisor has suggested that there'll be like a $500 citation. We're not moving in that direction yet, but we ask for your voluntary cooperation. Could you talk a little bit once again about the non-sworn staff that are out there with face coverings and educating people about the requirements?
Yes, so we have park staff that are deployed in the city, mostly in areas where we've seen the greatest amount of data, which is in our parks. So they're there every weekend. They're handing out masks to folks, asking people to comply. And as I said, we're increasing our signage, making it larger, more visible, and putting messages out on our website, tweeting out information, posting things on Facebook, just trying to make sure people understand the importance of it. So we do plan to look at how to deploy more people that are on the sidewalks beyond law enforcement, because the police are there, they're not handing out citations, but they do have additional masks in their vehicles to hand out to citizens if they come into contact with people that do not have a mask. But we are trying to look at how we can deploy people walking up and down our sidewalks. And that may be something that we can address with our ambassadors also, to help us out with that, that type of an approach. Right now, again, it is tailored just to our parks during the weekends to ensure that people comply. That's where we've seen the most activity.
And, you know, I know a lot of our restaurants in the downtown and other commercial districts are beginning to open and have outdoor seating. I visited a number of them over the past week. And they are, you know, setting up, you know, sidewalk seating or have permits to take over parking spaces, to create parklets. You know, we do ask, if you are patronizing a restaurant, unless you're eating or drinking, to please continue to wear your face covering. It is essential. I think that is the requirement for how those restaurants need to operate. So thank you. So I think that addresses, I think, the number of questions we received around enforcement of the face covering requirement. There was a specific question around the Healthy Streets program, which launched about a week ago,
Mhm.
and when 9th Street is going to open. And my understanding, 9th Street is one of the initial, I think, 1.5 to 2 miles of segment that is included in our Healthy Streets program. In fact, I was down in West Berkeley earlier this week and noticed that portions of 9th Street were closed. So I believe it is already closed on those days that we are doing the street closures.
So yes, can you hear me, Mr. Mayor? Okay.
Yes.
Okay, so yes, you're right. On June 11th, the city conducted our initial deployment of Healthy Streets, and we put out the signs and barricades at all intersections on 9th Street between Dwight and Hearst, while continuing to develop supplemental mid-block signs and flyers because those hadn't been deployed yet. But the trial deployment of those mid-block signs and flyers identified additional needs for the deployment, including the inability of our community members to produce enough large-scale advisory signs. So there was a need for the city to purchase more of those signs and barricades, and in a way to make sure that they are safely secured to the barricades in place, and to make sure that they can stay up in the area for an extended period of time. So we are now developing a more robust plan to redeploy Healthy Streets in early July, which will give us the opportunity to fix some of those deficiencies. And so more to come on that. Again, 9th Street between Dwight and Hearst, we ran into some dilemmas around how the signage was posted and the visibility of it. And so we're having to purchase more barricades and to purchase more larger signage so that we can make sure that the signage can stay out for extended periods of time. I do not believe at this time that 9th Street between Dwight and Hearst is functionally working at this time, but we are looking to improve that.
Thank you for that information. Yeah, I know a lot of Berkeley residents appreciate the rollout of the Healthy Streets program, and glad that we're continuing to work to refine and expand it, working in partnership with Walk Bike Berkeley and other community volunteers. Thank you. So those are all the questions related to operations. Now I'd like to go to our City of Berkeley Health Officer for some very specific questions around cases and testing. So this question, I believe you did answer in your initial comments. Where's the increase in cases in Berkeley coming from? What are stores and retailers who have essential workers doing to test their workers and notify customers of positive exposure? So you did touch on the number of cases and that we are seeing them largely being essential workers who are contracting COVID-19 and then bringing it home, and it's spreading in their household. And I know that we've been doing some specific work with grocery stores and other essential businesses to make those businesses aware of the testing that is available. I don't know if there's anything else you want to add, Dr. Hernandez, around what the work that we're doing with our essential businesses to make testing available, and particularly when we become aware that there's been an infection of an employee or employees at that business.
Yeah, that's what I want to talk about. In terms of when there's a case, in any case, we do an interview of that case, find out where that individual has been, and based on their time of being infected. So we determine from symptom onset, or if they're asymptomatic, from time of test. We use 2 days before they've either become symptomatic or 2 days before they take the test, and that's the standard by CDC, to see where that person has been exposing others, and then to the extent of how they're exposing others. So let's say they are someone who works in a grocery store or a retailer. We find out from that individual about their work schedule, what they do, who's around them. That would include coworkers, any exposures to the general public, and kind of characterize those exposures, how much time, what's the nature of the contacts with those individuals. And then we go and speak with their employer and do basically the same thing, so that we have information from both sectors to find out like who is truly exposed and who needs to be quarantined. So those would be the contacts. There has not been a need for us to notify the general public of anyone who has exposed someone in a general public or a public area, retailer, or what have you. We have had worksite exposures, but we've not needed to notify the general public, but we would if we are not able to contact those that are exposed, or if we notice that, say, that person is very likely to expose individuals regularly because of the nature of their work, and we haven't done that. So we interview, we confirm, and then we continue our investigation, and we continue asking questions of the case. We also work with the contacts as well. I will say that if there's a campaign now by the governor that says answer the call, that basically is, if you get a call from someone, like a lot of us don't answer the call if we don't recognize a number. Well, sometimes if you see a call, it's not going to be from a telemarketer. It might be someone from the city of Berkeley calling you to let you know that you were exposed to a case. So those are the things that we would do for individuals. If it's something that we cannot individually contact individuals because they're not identified, we would do something bigger if needed. But fortunately, we haven't had to. There may be a time that will occur. As we know, more and more people will be exposed because we've relaxed our restrictions.
Thank you so much, Dr. Hernandez, for that information. I know that there was a question around, we're releasing the numbers of positive cases, but not specifics around the individual and the circumstances around their contracting COVID-19. Some of that information is restricted for us being able to release under HIPAA. So we are trying to release as much information as we can that is available and that we are legally able to release. But specific information around this person has contracted COVID-19, they live at X address, or their name, or the specific details around how they've contracted COVID-19, we're not allowed to release that information. Obviously, they can voluntarily release information if they want to, but if you can just confirm that under HIPAA, there are limitations of what kind of information can be provided.
Yeah, there's definitely restrictions because of HIPAA, and then other restrictions. I've seen comments, not necessarily this round, but in others, where there's some concern about why are we saying less than 11. And that's something that you'll see on our website. You'll see potentially on Alameda County's, on the state's websites, and that's due to the standards that we have and that have been set, where we cannot give individual numbers. So if it's less than 11, it could be 1, or it could be 10. So that's where that's a standard that we're required to adhere to. So that's why you'll see it consistently throughout the different agencies that are reporting. There was, I remember, a question about zip code. Actually, that zip code information is available. It's released under Alameda County's website, where you can look and specifically see zip codes throughout Alameda County, which include the city of Berkeley, and you can see how many number of cases are there. We're not saying how many new cases are happening in those areas, but you can see total number of cases in those zip codes. And we link to Alameda County's website on our website, but Alameda has that by zip code. There was also a question about, do we do community acquired versus household spread? That is something we might be able to do. Again, some of that information is a little harder to pull out of our data systems because they're in things that we type in. They're not variables that we can pull out a code. So as we do for, say, gender and age, we're hoping to get that out by the next few weeks of July, specific to city of Berkeley. Ethnicity as soon as we can. That's also limited by our size, but some of the information about exposures are harder to get out of our systems because it's something that we have, that the staff is typing in. So we have to pull it from those fields as opposed to doing code by number of gender and other variables. So that's also one of our limiting factors that don't have to do with numbers, but it has to do with how we pull the data out of our systems. So I appreciate the question, but some of that information is a little harder for us to pull out, and will take some time for us to do it.
Thank you very much. There was a question around contact tracing. Could you share what's being done about contact tracing in Berkeley? What patterns are emerging about who is getting sick and what behaviors are causing exposure? You talked about, the most cases you're seeing are essential workers, but you did touch in your initial comments that we are increasing the number of contact tracers in the city of Berkeley.
Yes, and I would say the hardest thing for people to do is to isolate or quarantine at home. So that's a little tough, and some folks have families, young children, and it's harder for them to stay away from their families for the amount of time that they need to quarantine or isolate. So that's been our biggest factor. I know it's hard. But the more that you stay away from your family or your household housemates, the less likely they are to get the disease. So that's what we're seeing, though, is that we're seeing a lot of it spread within the household.
Thank you very much. And then follow-up question was around, is the City of Berkeley Public Health Department hiring and training more workers as contact tracers?
We're using internal staff. As the city manager mentioned, we have staff outside of public health, outside of health, housing, and community services, working with us, librarians, animal service individuals, parks, planning. The list goes on. So we're using that staff. We're also using some volunteers from the disaster healthcare volunteer service, and also the state of California. Some time ago, I would say it's been about 6 weeks or so, made an announcement that we could use state staff. So we are onboarding staff from the state in mid-July. So we're not hiring anyone for those functions at this point, and we're hoping that we could this capacity that we have will be adequate.
Thank you very much. There was a question about the Ohlone Dog Park, and my understanding is the most recent order did allow our dog parks to reopen.
Yes, so it's the Ohlone as well as the off-leash area of Cesar Chavez have been open since the 19th.
Thank you. There was a question around whether why therapeutic massage does not qualify as essential. Patients who need treatment have been unable to see certified muscle specialists for months. They compared, reopening restaurants to this type of business activity. And if we're allowing restaurants to reopen, why aren't we allowing this type of activity to occur? I know that, you're evaluating things based on, how certain business activity can safely occur with physical distancing. Like, for example, salons are not allowed to reopen yet because of the close proximity of hairstylists to their customers. I don't know if there's anything you'd like to add about this type of business activity, particularly, and why at the present time we're not allowing it as an essential business.
We are allowing medical massages, ones that you require a prescription from your medical provider to, in order to have services to improve an injury that you had, so you have sustained, and it's been prescribed to you by your medical provider. Other than that, we are not allowing that. We're allowing the medical massage to occur because it is a medical therapy, as opposed to the massages that we would all love to have. because of the contact. So there's additional, as you mentioned, closer physical contact that we are worried about. And we know that that's the reason why there's a 6 feet distance, is because we know that the droplets can travel that amount of distance. So that's why we use that number. So right now, it's, if you have a prescription and you need it, your masseuse should be able to operate. And if not, they should send in an email on that.
Thank you. 2 questions around face coverings. Are face shields okay to be used as face coverings to provide adequate shielding from transmitting the virus?
So I just learned there's different types of face shields now. So they have the traditional one that we know that basically comes from your forehead down to about your chin, and it's open. Those do not qualify as face coverings, and it's actually protecting the wearer from any sort of splashes that are coming to them. So it's not what we were wanting the face coverings to do, is to protect other people from your own saliva. So the face shields that are just the ones that come down to your chin, those do not qualify. Apparently, now there's ones that have an attachment on the side that is connected to the edges of the face shields, where there's cloth that you could either tuck into your shirt or tie behind your neck. And so you could wear that. I'm not sure how comfortable it is, but that's definitely something I know schools and childcare providers are looking at using, because it allows individuals to see facial expressions. So kids especially, or those with disability that need to read lips, can use. That's acceptable, but the other ones are not qualified for the face covering. So something I learned just like 2 days ago. So I'm happy to share that. Those are acceptable, but they have to have that covering, and has to be completely covering basically covering your mouth so that there's no escape of saliva.
Thank you very much. There was a question around the washing of face coverings, and this resident said, we're told to wash our hands for 20 seconds in cold water, but for masks, I keep hearing hot wash, hot dryer. Can you wash face coverings in cold water, or do they need to be washed in hot water?
The biggest thing is that would be the best, is the warm water. But the biggest thing is having the soap and the water on the face covering. Some people have to hand wash them and hand dry them. That'll suffice. Best is warm water, throwing them in the washer. That happens every week in my household. That's the last load that goes in, are all the face coverings, and then they are put in the basket by the door. They're put in the cars, so just in case you forget them, that's where they are. So if you don't have that same routine, or you don't have the ability to wash them in a washer machine or dry them in a dryer, you can hand wash them.
Thank you. Question around when Berkeley Public Libraries will have curbside pickup. We are allowing curbside pickup, to my understanding.
The curbside, my understanding is they're already occurring for those that had scheduled orders or already, and that's happening curbside. But on Monday, the 29th, is when curbside will occur. I just looked on the website before this town hall, and there's information there about curbside officially opening on the 29th.
So starting this week, you can do curbside pickup of material from the Berkeley Library.
Yes.
We are not yet ready to open up our libraries for people to visit, but we are going to be allowing curbside pickup.
Absolutely.
There was a question around music venues, and specifically the Starry Plow, which is a long-standing restaurant and music venue in South Berkeley. And this question was, when will places like the Starry Plow be allowed to host live performances again? They also asked, can the city give them the same support they gave to every other music venue? The latter question, I believe, relates to the Berkeley Relief Fund, where we did provide grants for nonprofit arts organizations, and some of our nonprofit music venues did receive grants. I believe the Starry Plow did receive a grant as a restaurant through the Berkeley Relief Fund, but we're not at the phase yet where we're going to be allowing large events and music venues to be able to have in-person performances.
And I will say singing is extremely, extremely risky. So that's where, from a public health perspective, it's going to be something later that will be available. So that's I just want to point that out too, is that if there will be more, availability for performances in the future, which won't happen, as I mentioned earlier, in the next week or so, singing will be one of the last activities because of how high risk it is.
Thank you. And I'll just say that, we are very concerned about our arts nonprofits and our live performance venues in Berkeley, which really add to the cultural life of our city. Being able to get through this difficult time, I would imagine we're months away from being able to allow that type of business activity to occur. Many large festivals have been canceled for the year. And I know it's difficult. I myself love live music. It's been very challenging to not be able to go to some of our venues in Berkeley and in the Bay Area. Next year, that might be a possibility, depending on conditions and how we're able to manage COVID-19. But the city of Berkeley is here to support our music venues through our Berkeley Relief Fund and our revolving loan fund. And we're going to continue to work with them to make sure that they get through this. So outdoor dining, this resident had asked, why is the West Berkeley Beer Garden able to reopen? I believe that's one of several businesses that already did have outdoor seating, so they're allowed to reopen. Consistent with the guidelines, this resident did note that people are not wearing masks. Unless you're eating or drinking, you are required to wear a face covering. The pools, I think we touched on the pools. I think you had said, Dr. Hernandez, that within the next 2 weeks, Alameda County is going to be submitting an attestation to the state of California that might enable us to look at allowing other types of activities, and allowing use of our pools could be one of those activities that I believe you had stated that we could consider once the state provides that sign off.
Right, that's something we're looking at. It's definitely something that when you look at the whole menu of available services or activities that could be allowed on for those city jurisdictions that have attested, some level of swimming is allowed. So we're hoping that we can do something like that, as long as our numbers aren't any worse than they are now. And again, that's going to be based on the data and how our indicators are at that point. But that one of the reasons to have that attestation is to have that flexibility.
Exactly. There were a couple of questions around reopening, and they're seeing an increase in infections. I mean, the more testing you have, the more infections you're going to see. But there's no question, nationally, we're seeing an increase in infections, particularly those states that I would argue, and this is my opinion, irresponsibly did not continue their shelter-in-place orders and moved very quickly at the end of April and March or May to reopen. We're seeing an increase in infections there. We're also seeing an increase in infections broadly in the Bay Area, despite our best efforts to control COVID-19. The question is it manageable? We know that reopening is going to result in some increase in the number of infections. Is it manageable? Is it manageable for our hospitals? Is it manageable in terms of testing so we can track and trace the level of spread? Until we have a vaccine that is widely available, there is going to continue to be the risk of residents contracting COVID-19. It's a question of how we continue to follow the precautions to shelter in place, to physically distance, and to wear face coverings to help reduce the transmission so we can manage the controlled spread. I think that's what it ultimately comes down to. So, Dr. Haynes, anything else you want to add around, we are reopening, but at the same time, we are seeing an increase in cases. How are we, making those decisions on reopening so that we can manage the spread of COVID-19 and ensure that certain business activities is done safely?
So it's a balancing act. Basically, we're using the 5 indicators that I reported on earlier today, specifically looking at our increased cases and hospital capacity, hospitalizations. Those are the key ones that we're looking at. That's one of the reasons why we instituted the shelter in place back in March, was because we were worried about the impact on hospitalizations and the subsequent impact on the health of our community, because there was not going to be enough hospital beds, ICU beds for those that needed that level of care. So we're watching that now. We're also looking at the impacts of these restrictions on the community's emotional and mental health. We know that that is something that we have to look at. We also look at the impact on children, on education. We know that having the school closures, it's been an impact on how the ability for children to learn and socialize, meaning not socialize in terms of having fun, but also being able to build their social, emotional, mental health characteristics and their abilities to cope and to be good citizens. So those are the things that we're looking at as we move forward, and we're doing it carefully, and hopefully we won't have to put additional restrictions on, but that's part of our toolkit. Also part of our toolkit are the face coverings, the shelter, the social distancing. Those are the big things. And even though outside dining is available, you're probably not going to do it as frequently as you might have done before. So you have to be very careful about what you're doing.
Yeah, and I think one issue also is how long you are in a particular location.
Yes.
So while outdoor dining is allowed, you shouldn't spend hours sitting outside. The longer you're at a location, the more potential that you can actually contract COVID-19. So duration is also a consideration that people need to really think about. How long bus?
So Dr. Hernandez, I really need for this 15-year-old of mine to be outdoors. You need to give him some space. It's driving me crazy. I can't imagine with some of the parents with those that are younger than 15, like, oh my goodness, it is something.
Well, and we've talked a little bit about this, even with some of the activities that have been allowed. I have seen changes and heard from individuals where kids are seeing a sense of purpose that they didn't have before. And that's big. That's not a subtle or something that's not significant. So we do have to look at that, and also look at the equally important and significant impact on people's health and impact on those that are not able to stay home because they have to work, and not able to stay healthy because they have chronic disease. So when I say it's a balancing act, these are all the pieces that we have to look at. And some of that depends on the community to protect themselves and protect each other. And I would say as a whole, City of Berkeley is doing well, the community is doing well, and they care about each other, and we have to continue to do better and better.
Thank you, Dr. Hernandez. There's a question around social bubbles, which I know I've gotten a lot of questions about. This resident has said, I've had friends visit one at a time in my backyard, which is accessible through the outside. I disinfect a chair beforehand. We sit at least 6 feet apart. Is it safe for us to remove our masks? So
first I want to say, those individuals, I'm guessing that is part of your bubble of 12. So as long as it's at your bubble of 12, we encourage you to wear your face coverings. However, it's not required. What's required is that it's outside and that you limit the size to 12, no more than 12 individuals. If it's less than 12 individuals, that's great, but it doesn't change those requirements of being outdoors and no more than 12. So the face coverings are encouraged, but it's not a requirement.
Thank
And
you.
it's really great that she or he is disinfecting like they are.
Absolutely, yeah. I mean, if it's within your 12, and could you maybe remind us the duration of which a social bubble should occur? I mean, I've had a social bubble from the very beginning. You know, my household is
Okay.
its own social bubble.
Okay, that's fine.
I have, as much as possible, with the exception of coming to City Hall, been sheltering in place and conducting business from my home. Adding new people to my social bubble, but keeping up to that social bubble. Could you talk maybe about the number and the duration of how long these social bubbles should exist?
So we don't have a duration or frequency of when you socialize with your bubble. Basically, as you mentioned, when we were talking about outside dining, it's the shorter the better, the smaller the better, because we know duration and proximity and frequency are factors in terms of increasing your contacts. When we look at considering someone a contact to a case, we use 15 minutes and less than 6 feet. So that's not, that's why we want that 6 feet distance to occur. So that's what we're looking at. Facial coverings reduce that that contact as well. So that's what I would say. Shorter, the smaller, the better. And then the more physically distanced, that would be great. I don't know how reasonable that is in certain settings, but the scenario that the first question, that was made sounds great. You're on mute, Mr. Mayor.
Thank you. Just a few questions on testing. I'm going to try to consolidate them.
Okay.
So does the city of Berkeley coordinate test results that are done outside of Berkeley, for example, a Kaiser facility, if they are a Berkeley resident?
Yes, so we have what's called an electronic lab reporting system, and also a reporting system for cases, case from providers. So the doctors and medical providers have to report. They can either report by fax or through our electronic system, and almost all labs are reporting through the ELR, the electronic lab reporting. So if you happen to go to Kaiser Oakland and you live in Berkeley, Kaiser Oakland reports to us through that ELR. If you happen to be in LA at Kaiser in LA, or you're using a Quest lab in LA, that'll come to us as well.
Thank you. And then last question, Dr. Hernandez, is how can Berkeley residents who are Kaiser members without symptoms but are concerned that they've been exposed get tested? Once again, our new testing site in Berkeley is available to everyone, I think, regardless of whether you have health insurance. I'm a Kaiser member, for example, and I was able to get tested just a few weeks ago. So the number to call to sign up to get tested, I'll repeat that, is 1-888-634-1123, 1-888-634-1123. And also you can go to the City of Berkeley's website, cityofberkeley.info/COVID-19. And there's a link to also be able to sign up online to get tested. So any Berkeley resident, whether you're symptomatic or not, can get tested at this new testing site.
Absolutely.
So thank you so much, Dr. Hernandez. Just a few non-COVID related questions I want to address. This one is about the budgets. In a time of a public health crisis, why are we making across the board cuts? We cannot afford to lose funding for public health programs or housing programs or programs to serve the homeless. I want to note that the City Council will be voting on adopting our fiscal year 2021 budget update on Tuesday. And I'm working hard over the next few days to develop a set of recommendations, building off the work of our city manager, to ensure that those essential social service programs homeless services, and other social services can continue. I'll just note that we've done a very good job of avoiding cuts to those programs. What we've largely done is deferred positions as a way to balance the budget. Obviously, that does have an operational impact, but we've done our best to maintain that safety net. The council will be discussing whether to make some adjustments to fund other new programs and priorities. So I want to thank the hundreds of Berkeley residents who have called, who have emailed, who participated in our meetings with your ideas around what the city should prioritize in its budget process, particularly around how to balance the police budget and how to transform our approach to public safety. And those are all issues that we'll be discussing this week as well as in the coming months. So if you would like to participate in the discussion on the city budget, please call in or Zoom in to our meeting on Tuesday at 6 o'clock when the council will be voting on the fiscal year 2021 budget. Now, I want to take this opportunity to thank the city manager and all the staff in the city organization who've worked really hard to try to find a way to balance our budget. No, we actually have a $40 million deficit. Unfortunately, that number has been increasing when we've learned of certain revenue sources where we've seen decreases or certain positions or programs that we had to fund. And they've done a really excellent job in finding a way to balance our budget while also preserving those essential services. I want to thank our city manager and our budget manager for all their work. It's a question around hate crimes, and sadly, we are seeing an increase in hate crimes in Berkeley. A number of them targeted specifically towards African Americans and people that are standing in solidarity with the Black Lives Matter movement. There are 3 incidents that we've all seen the videos of. The climbing program at Indian Rock Park, where Miss Taylor, the operator of that program, was confronted by a resident who said a very racist and derogatory statement. People tearing down flyers, people wiping out chalk writings on sidewalks. We've seen, sadly, an increase in racial hostilities, even in Berkeley, and it's very troubling. It's absolutely unacceptable, and we need to recognize that despite being this liberal city that is very committed to racial equity and social justice, that racism does exist in our community. And so we have to recognize this, we have to call it out, we have to confront it. And I will be working with our city manager on bringing forward a proposal around how we can expand hate crime reporting and addressing the issues of hate crimes in our community. Because sadly, despite the fact that I think our nation and our community has really woken up to the need to address systemic racism, we've also seen that racist responses to that call for change, even in Berkeley. And we know certainly in the COVID-19 pandemic that there was a great deal of racism and hostility towards Asian Americans. I mean, our president has said a number of irresponsible and derogatory things around China and Chinese Americans, and that has impacted Asian Americans even here in the city of Berkeley. So at this time of just increasing challenges in our country and division in our country, it is critical that we continue to make Berkeley a safe place for all people to live. And I know that's a priority that's shared by our police department and by our city manager. So please know that we take this issue very seriously, and we'll be certainly doing more in this area in the coming weeks. There was a question around, why are we tackling homelessness alone as a city, or why are we not working with other mayors in the state of California to develop more sort of region-wide, statewide, holistic solutions? I want you to know that while we are working very hard to end homelessness in Berkeley, we are absolutely working with the county, with fellow mayors, and with the state of California to develop programs to not just serve Berkeley's homeless population, but to address the broader impacts of homelessness regionally. I actually chair a working group of mayors in Alameda County that's working in partnership with our county supervisors and county officials to increase resources to cities like Berkeley to be able to address our homeless crisis. And I work very closely with state officials as well on these areas. So Berkeley is not an island. What happens in one community impacts another community. And so we need to address this issue regionally. We need to address this issue statewide. We need to address this issue nationally. It's a national problem. And please know that we are absolutely working in coordination with fellow mayors and county officials and state officials to develop programs to address the needs of our homeless, but to also recognize that this is a broader regional societal problem. Question around outdoor dining. What is the status of outdoor dining? We actually just on June 19th, as part of the implementation of the recent order, allowed businesses to be able to have outdoor dining with certain requirements around physical distancing. And the city council adopted on June 16th changes to our city laws to streamline the process for restaurants to get permits to be able to do sidewalk seating, to create parklets in order to allow more outdoor dining. And so our city staff been working over the past several weeks to not just implement this streamlined permit program, we're waiving fees for businesses that want to do outdoor dining. And then we're also evaluating how we can expand opportunities for outdoor dining. So many of our businesses in the downtown are beginning to do outdoor dining. Some have implemented outdoor dining or exploring it. I know 4th Street, there are a number of restaurants on 4th Street that have implemented outdoor dining. And we hope that this will expand, not only so that our residents can patronize our local restaurants, but also can get outside and be able to do so safely. There was a question around San Francisco just rescinded outdoor dining with alcohol. What is Berkeley's response to this? And my understanding is that, and correct me if I'm wrong, Dr. Hernandez, but if a restaurant is permitted to do outdoor dining, they have sidewalk seating, or they're able to repurpose parking spaces or some portion of the right of way, that somebody could purchase alcohol, but that's along with a meal. They can't purchase alcohol just by itself.
Yes, that's correct.
Right. And I understood for San Francisco, though, that they did have the purchase of alcohol to go. Is that correct, Dr. Hernandez? Are they rescinding that as well, the purchase to go?
I haven't heard any of those changes occurring.
And
we can look.
Since the shelter-in-place order, at restaurants that were doing curbside pickup, that those restaurants were able to sell alcohol to go as well. And that was in response to the state ABC loosening some of their regulations to allow purchasing beer, wine, or other spirits with meals. So the state has allowed flexibility for restaurants to do that, and that's been the case since I think April, so or maybe even late March. So, but it has to be incidental to the meal, cannot be on its own.
Right, and I haven't been tracking any changes with ABC, but I hadn't heard of any at this point. I know San Francisco's I believe they're going for their attestation as well, so that might change some of those requirements. But I haven't heard anything specific.
Thank you. Just question on the testing website. This resident said the website to test is hard to navigate. Just want to note that this site is run through the state of California, and people who have difficulty navigating the site can actually call 1-888-634-1123. Once again, it's 1-888-634-1123.
Can I just say there are other testing availability too? CVS is also testing.
That's right.
They have specific criteria for letting people be tested. That's not happening in Berkeley, but there are other opportunities. I tried to get tests at CVS just for fun, at least to look at getting registered. It is easier than the Optum site, but they are going to ask you a number of questions.
Thank you. Thanks for that information. A few questions on our undocumented community and how undocumented workers or households can get relief. The California Disaster Relief Program for immigrants was created. June 30th, which is this week, is the last day to apply. Alameda, anyone who's undocumented in Alameda County can access this program through Catholic Charities of the East Bay, and they can call Catholic Charities at 415-324-1011 or go to CCEB, all one word, cceb.org for more information. So the state several months ago actually provided funding for undocumented workers through a relief program, and Catholic Charities of the East Bay is administering that program in Alameda County. I will also note the City Council on Tuesday will be considering whether to create our own basic needs fund for the undocumented community in the city of Berkeley, knowing that people who are undocumented are not able to access many federal or state benefits. And we need to provide that safety net for our undocumented communities. So while it's great that the state has provided these resources, I believe the funds are limited, and we want to look at expanding the support that we can provide our undocumented community during this very challenging time. Many of these people are essential workers. They're really putting their lives on the line, and we need to provide support for our undocumented community. And just seeing if there are any additional COVID-related questions.
So, Mr. Mayor, can we have Dr. Hernandez share the webinar that's coming up this Sunday?
Yes, that'd be great. Thank you.
So this Sunday at 2 p.m., there's going to be a COVID webinar in Spanish by Latinos Unidos and City of Berkeley, where we'll do a little bit of information sharing on COVID-19, more about the disease process, about testing availability. I believe a member of the school board is going to be present as well. And then we're going to open it up for questions. So that's one of two webinars that we're going to have with Latinos Unidos. The first one is going to be in Spanish, and then the second one will be in English language. So that's this Sunday, the 28th at 2 p.m. I don't have the flyer in front of me, but it's through.
If you go to Latinos Unidos de Berkeley on Facebook, you can get the information about how to participate in this event.
Right, and it's a Zoom event, so it's pretty easy to link onto.
Thank you. Those were all the COVID-related questions. We did not get to your question this week. We will definitely get to it next time. And please know that we're doing these virtual town halls every 2 weeks. So our next one will be in 2 weeks. And I just want to take this opportunity to thank Dr. Hernandez and our city manager for all your hard work. I know our community really appreciates it. It's been a long 3 months, 4 months, but I'm really proud of the work that our city organization has done, and our community who's really stepped up and really taken this very seriously, and it's making an impact. We are helping slow the spread of COVID-19, and we need to continue to be vigilant. While we are safely reopening and people are beginning to access certain types of businesses and activities that were restricted for a period of time, we need to do so safely. Please continue to practice physical distancing when you are outside your house. Please continue to wear a face covering, and please continue to know that despite the fact that we are starting to transition back to some semblance of what it was before the shelter in place, that it's not fully safe, and we must continue to be vigilant to protect ourselves and protect our community. So I want to give Dr. Hernandez and the city manager just an opportunity to say some closing thoughts.
I have very little to add. I mean, basically what you've said, Mr. Mayor, really is on point. We really need the community to continue to protect themselves. I want to thank the community for their support, both with continuing to shelter in place as much as possible, to wearing their face coverings. Those are big things that we need individuals to do. I want to thank both the city manager and the mayor for the support. I will say, if anyone has read the news, health officers and public health officials throughout the state and nation have not had the same level of support that I experience here in the city. So that allows me and the staff of the city to protect this community. So I just want to thank not only city leadership, but also the community for continuing to provide that public health support. And I'll end there.
Thank you so much. Madam City Manager.
Thank you, Mr. Mayor. I'll just wrap up by saying it's always a pleasure to be here and to have some time with the community and answer questions. It's a really tough and challenging time for all of us, and we just have to stick together, make sure we are continuing to do those things that keep us all safe. And I want to thank your staff behind the scenes for orchestrating these sessions with us. I know it's a lot of work, and we are very grateful and appreciative of the organization and the coordination that it takes to get this platform in place. So thank you to them, and also to my amazing city leadership team. They are stepping up. It's been a nonstop 24/7 operation for all of us, and they're hanging in there. And we want the community to know that we are doing this for them because we believe in service. So thank you so much, and we look forward to seeing you in a couple of Saturdays.
Thank you so much. Well, thank you. Thank you for your time. I know our community really appreciates it. I think this kind of interactive nature is not something that's common in the state of California, to have our public health officer and the city manager to directly engage with our community and to answer questions. And so I just want to thank you so very much for your time and your participation. And with that, thank you for tuning in. Please stay tuned for information on our next virtual town hall, and please be safe and healthy.